anterior lateral hip flexor complex mobility matrix, we will use this strategy to also go after the anterior hip capsule to give us a little bit more extension. And in terms of the hip flexor, we're going after and targeting that TFL, a little bit more, the tensor fasciae latae, which is in the upper left outer portion, or upper outer on the right hip, right portion of the hip right here, which comes together with the gluteus maximus to form the iliotibial band, the IT band, which is a very thick piece of connective tissue that runs from the outer parts of the hip all the way down to the outer part of the knee, Gerdy's tubercle. If we're going to go after strategizing the right TFL, we're going to go right foot on a wedge, and we're going to go foot up on a box, anterior medial kind of step up lunge pattern position. So my right arm, as I slide with my left hand, my left hip and pelvis up on a 45-degree angle to the right, my right arm is going to reach up overhead and to the left, and it's going to reach up towards the ceiling or the sky to give me that frontal plane stretch right here. So I'm going to go overhead to the opposite side as a strategy to mobilize that TFL, and I'm shifting in and out. I will, to make this a little more three-dimensional, with this shift from the bottom up in the legs, I'm going to go with my right arm, and I'm going to go a little bit more with the reach overhead to kind of get my sagittal plane driver right here. So right arm overhead behind me. I'll get both, or I'll get a little bit more of the sagittal plane. If I want to wind things up and get frontal plane and transverse, in this position right here, I'm going to go with a little type 1 in sync. My left arm is going to rotate and reach to the right, kind of up and overhead, toward head height, and right arm is going to reach overhead and to the left. It's a little top-down, transverse, and frontal plane on the driving front. If I want to get transverse and also sagittal, I'm going to go left arm, rotating and reaching up and to the right, and then I'm going to continue to slide and glide and reach with my right arm, going overhead and behind me. TFL specifically, mobility strategies for a position.